Hi, I'm Dr. Choong Fong from the International Specialist Eye Center. I'm a consultant ophthalmologist specializing in refractive cataract surgery as well as pediatric ophthalmology. Today, I'll be talking to you about cataract surgery or phacoemulsification cataract surgery, the commonly done cataract surgery in Malaysia and in fact around the world. I'll be showing you the different steps involved in the cataract surgery from the beginning of the surgery right until the end. Now this video is unedited. In other words, there's no editing of the video, so it's just showing you the whole procedure in real time. I'll be narrating through the video, just telling you the different steps involved in it. So shall we begin? Enjoy. Now when we prepare someone for cataract surgery, we first of all put an eye drop to numb the surface of the eye so that the surgery then becomes painless. As you can see here, we make two incisions on the cornea, a larger one which measures about 2.4 millimeters and a shorter one that measures about 0.5 of a millimeter. And it is through these two incisions that we will do the surgery. Now this step is where we introduce a gel-like substance called VISCOELASTIC to stabilize the front part or the front portion of the eye. Now this is a special forceps that we use, whereby we use this very fine forceps to make a circular tear in the lens capsule. The lens capsule is the transparent lens bag, if you like, that holds the lens in position. So by making a small circular tear in front of the lens capsule, we expose the lens itself, which in this case is a cataract, so that we can have an access to it. The next step is HYDRO-DISSECTION, whereby we separate the lens material away from the capsular lens bag. This helps mobilize the cataract within the lens bag so that it is mobile and easily removed. This part of the surgery is actually very important so that we have got good movement of the cataract so that the surgery is uncomplicated. The next step is the phacoemulsification procedure. Now the phacoemulsification involves a probe that has got a little hole in the center while there are fluid coming through the side of the probe. Now the probe itself is made of steel, a metal material that vibrates at a high frequency, therefore breaking up the cataract. It is a bit like a jackhammer, using a jackhammer to break down stones. In a similar fashion, the probe of this ultrasound probe will break up the cataract, therefore turning it into liquid. And therefore, by applying suction or vacuum and continuously breaking down the cataract, we can then emulsify, turning something solid into semi-liquid form so that we can then aspirate and take it away. You can see that this cataract initially is quite big and is broken into smaller pieces and aspirated or vacuumed away using this specialized probe. Now once most of the cataract is been removed, what is left behind is some lens material that you can see here, like transparent veils. Now these are actually lens cells as well as what we call cortical lens material. So this is the portion of the surgery whereby we aspirate or we vacuum away the remaining part of this lens by using this special equipment that sucks away at the lens material. And once it's done, you can see that the lens capsule now no longer has the lens inside or the cataract inside, and you can see that it's actually rather clear. But this eye still cannot focus because it hasn't got a lens in it. So we introduce more viscoelastic material that stabilize once again the front part of the eye so that the lens bag is nicely open. And once everything is stable, we will prepare the lens implant by carefully folding it into an introducer called the cartridge. You can see the lens now going into this introducer, and it is through this introducer that we insert the lens into the eye, as you can see very soon now. There you go. So the introducer is now anchored to the wound, and then the lens is slowly and gently injected into the eye. Now you can see the lens implants gradually unfolding itself inside the lens capsule, inside the lens bag. and now it's carefully positioned in the lens back. And then using this little probe again, we remove the viscoelastic that is inside the eye. And this part is very important. We need to remove all the viscoelastic, otherwise this patient may have a high eyeball pressure after surgery, which can be a bit uncomfortable. So once all the viscoelastic has been carefully removed, then you can see that the eye now is clear and nice with an implanted intraocular lens inside. Following which, we then close the wound by injecting fluid in the cornea to hydrate the cornea and therefore making the wound integrity good. And once we have secured the wound, we just check and make sure there's no leakage, and then we give a little injection of antibiotics in the eye, and this will help prevent infection. That's how a cataract surgery is performed. I hope you enjoyed the video, and thank you for watching.